Hello, in this video, I will be answering frequently asked questions about ADVİL tablets. If you find this video helpful, don't forget to subscribe to support my channel. What is ADVİL and why is it used? ADVİL is a medication used to relieve pain caused by various conditions such as headaches, toothaches, menstrual cramps, muscle aches, or arthritis. ADVİL contains two active ingredients, ibuprofen and paracetamol. Ibuprofen is a non-steroidal anti-inflammatory drug, and paracetamol is known for its pain-relieving and fever-reducing properties. This combination works by blocking the production of certain natural substances in your body that cause inflammation, helping to reduce pain, swelling, and fever. How to use it? Take ADVİL orally, as directed by your doctor. It is recommended to take the medication with a full glass of water. Do not lie down for at least 10 minutes after taking the medication. If you experience stomach upset, you may take it with food, milk, or an antacid. Dosage and duration of use. Dosage is based on your medical condition and response to treatment. To reduce the risk of stomach bleeding and other side effects, use the lowest effective dose for the shortest possible duration. Do not use ADVİL for more than 10 days unless directed by your doctor. For ongoing conditions such as arthritis, it may take up to 2 weeks to see the full benefit of the medication. Who should not use ADVİL? People who are allergic to ibuprofen, paracetamol, aspirin, or other NSAIDs should not use this medication. It is not recommended for use during the last 3 months of pregnancy and for breastfeeding mothers. While this drug rarely passes into breast milk, consult your doctor before breastfeeding. Avoid alcohol or cannabis use while taking this medication, as it may increase dizziness. Be cautious of sun sensitivity while using ADVİL. Wear sunscreen and protective clothing when outdoors. If you develop sunburn, blisters, or redness, inform your doctor. Before undergoing surgery or dental procedures, make sure to inform your doctor of all the medications you are taking. Side effects. ADVİL may cause side effects such as nausea, vomiting, headaches, diarrhea, constipation, dizziness, or drowsiness. In rare cases, it can lead to serious side effects such as stomach intestinal bleeding, kidney problems, heart attack, or stroke. These risks may be higher in older adults. Don't forget to like the video, subscribe to the channel, and share your thoughts and experiences about using the medication in the comments.